Welcome to Advanced Nurses. We connect with nurses who inspire other nurses by sharing their experiences. And so we're able to bring that information to you. Oh. Hi, I'm the educational consultant with Advanced Nurses at ACD4N, and today I am with Mwaya. Now, me and Mwaya have met many times in the past to discuss things from toxic workplaces, and also just really how to deal with difficult work within the healthcare space. But today we're going to be talking about something, a really sensitive topic. We're going to be talking about recovery, substance abuse within healthcare, like, substance abuse dealt by healthcare professionals. Start over again. 1, 2, 3. Hi, I'm the education consultant with Advanced Nurses at ACD4N, and today I have Mwaya. We've met many times before. We talked about things like toxic workplaces and how to deal with stress within healthcare as healthcare professionals. And today we're going to be talking about another issue, a sensitive topic that affects healthcare workers, and we're going to be talking about it from that perspective. And so today I'm just going to start off by just describing what an impaired nurse is. And we're going to be talking about that. We're going to be talking about recovery and the importance of having peer specialists and other healthcare professionals that can be advocates to individuals going through this. So just to begin, if you've never heard the term impaired nursing, I'm just going to give a brief description of what that is. Impaired nursing is a professional, all right? And this is also a legal term that describes a nurse whose practice is compromised by condition, most commonly substance use, but also including untreated mental health issues like severe depression or PTSD. The traditional approach was punitive, leading to license revocation. However, the modern, more compassionate and effective approach focuses on early intervention and alternative to discipline programs. These programs, often run by state boards of nursing or peer-led organizations, prioritize confidentiality, treatment, monitoring, and a structured return-to-work agreement. The goal is twofold: to ensure patient safety, and to rehabilitate a valuable healthcare professional. Again, the goals are twofold: to ensure patient safety and rehabilitate a valuable healthcare professional. Recognizing the impairment in a colleague is not about snitching. It's not about keeping secrets, guys. It's about keeping the public and keeping colleagues safe, right? And so by this approach, we're offering a lifeline to someone who is likely suffering in silence and probably dealing with a lot of internal shame. So it is critical that we shift the culture from one that blames to one that supports individuals, especially today, as we're going to talk about healthcare workers, supporting healthcare workers who are struggling in silence. So, Ms. Mwaya, I just want you to first just let us know about your background in this space and the kind of work you've been doing in this space.
So thank you for having me. I am so glad to be here and to talk about such an important topic, mental health recovery, right? And especially in the healthcare workspace. I myself have been in recovery for several years. I always like to talk about personal experience, right? And I have been in recovery from substance use, specifically alcohol, for many years. It hasn't been easy. And one thing I can say is that I'm always grateful for the support system I have. It's something also that I think in the healthcare space that we don't talk about. But most problems, especially substance use dependency or addiction, comes from the space of whether work burnout, not having the cope to space, not having the abilities to cope. So you start thinking, okay, I worked an extra shift, I need to go to sleep. What am I going to do? You might start taking glasses of wine, or, oh, wow, I have these painkillers and these things really let me sleep last time. Let me do it. And before you know it, you have become dependent on those substances. One thing you've brought up is that sometimes people at work can see that you're not in the right mind. Therefore, you're putting patients and others in danger, right? Because you're not functioning at your full capacity. And that if colleagues talk about it or say something to your supervisors, it can come across as snitching, which is really not true. Because I think why we're having this conversation in your space is for us to raise awareness. How do you help someone that you know is struggling with substance use or some other mental health issue? I think the best thing to do is to talk to them and see how they can get professional help. One of the things for me being in recovery, and that has worked for me, is peer support. I think that human beings, we are social beings, right? We like to do things in groups, we like to see other things. And not only that, I remember the other day I was taking a walk and I saw some ducks walking together and they were just following each other. And this is what we do as humans too. So if you find that a nurse speaks to you and they tell you, or a physician or some other provider tells you, hey, I'm also in recovery, I think it helps you realize that maybe you're not a failure, because most of these things with addiction is that we are too hard on ourselves. Sometimes we don't know how to deal with the failures and move on from that. The system of peer recovery, why I really support it, because it has worked for me. I have gone to peer support meetings, I've gone to people who are going through similar things, and I find that it's very powerful because it helps us deal with whatever is going on. A lot of people, especially nurses in healthcare, do a lot of work and they're not really supported, and when you're working in that kind of environment, I think that we are not given a blueprint on how to deal with these things when they come up. And it's completely normal for you to start turning or finding supports elsewhere, even though those supports might not be healthy. So what do you do if you find that a friend of yours or a colleague is drinking on the job or seems to be impaired? I think that's the term you used. I would strongly encourage having a one-on-one conversation with them and just be honest. Like, hey, I noticed that for a couple of days you've been smelling like alcohol or you've been behaving in such a way. Is there any way I can help you seek professional help? Why do we use professional help? Professional help, especially in peer mentorship and things of that nature, is that people have been through a lived experience, right? And they are able to use their own experiences to help you go over the challenges that you might be facing. So one of the things about peer recovery, they found that it works because people are not ashamed. There is no stigma. People have been in similar situations and they are able to talk about their own ways on how they dealt with the particular challenge. I'm always open about, you know this from when we first met professionally and now that we continue to work together. I always talk about my recovery because I think it's important for people to realize that, I've had that challenge, and I overcame it, and I'm still overcoming it. Even when I teach, when I talk to my students, I tell them that I'm in recovery, just because I think we need to raise awareness on what recovery is, what substance use addiction is, because I think we also always have pictures of all people in Kensington or somebody really struggling, but sometimes people can be professionals, dressed up, looking well, but they are functioning either alcoholics or other substance use that they are misusing. So if you open up and tell people what you're going through, you don't know who else you might touch, and they might feel compelled to share their struggle or ask you for support. Any other thing you wanted to talk about or add on?
Well, so yeah, what I would definitely like to share that, and thank you for what you detailed just a moment ago, because I think the one of the things that you said that really stood out
Mm-hmm.
was like, kind of speaking with that colleague and, having that compassion. I think that oftentimes what we're missing a lot of times in healthcare is that compassion. And I think it's because often in our curriculum and training, you're directed to have compassion for patients and not necessarily your peers.
Or for
And so,
yourself. Or for yourself,
or
Raquel.
for yourself. Well, listen, forget about yourself. Most nurses will tell you that they didn't know they could hold their bladder for 8 hours until they became nurses. And this
No,
is not a joke. It's not even okay. But
yeah.
what you can literally spend every hour telling yourself that you need to go to the bathroom and completely get distracted and pulled away taking care of a patient. And the urge in many cases will go away. The urge to actually empty your bladder will go away just because you're so focused on what's in front of you. And I would argue that there has to be some type of internal wear and tear that has to be going on inside of your body for you to consistently, put your body through that kind of rigor. Like, you're just telling yourself, I'm going to hold back from drinking water. I'm going to hold back from emptying my bladder. I'm going to hold back from taking a break. I'm going to hold back from getting some fresh air because I just got to do this one thing for this patient real quick. And I think that after some time with that, not only do we lose that compassion that would allow us to extend ourselves to our peers and ask that kind of question, sometimes we also get a little God complex where we believe that because we are the source of information and support for patients and patients' families, and in some cases we are the voice of so many different our colleagues or patients when we're speaking to like upper management or like executive lines. So with that being said, sometimes we just really turn off that voice inside of us or in our heads that's telling us, hey, are we okay? And so I see a potential really for a lot of issues to go ignored, but more importantly, mental health, and then also those early warning signs if someone is going in a route or exploring options that may actually be harmful to everyone. Again, the patients and their colleagues and to themselves. Um, but one of
It
the
is.
things that I did,
Mm-hmm.
and I'll just be really quick with this.
Mm-hmm.
An incident where I remember working with a nurse who shared with me. She said, I'm in an impaired nursing program, and I'm really finding a hard time, getting work. Like where she was working was kind of like more of a part-time job. We were
Mm-hmm.
teaching actually at the time, and she was saying, I want to go back in the hospital. And at the time, she had her master's degree, a very intelligent nurse, but she was just saying, my experience has been that when I'm interviewing for jobs, is
Mm-hmm.
that once I'm upfront with them about, being in an impaired nursing program, that instead of getting that support, I'm dealing with the same stigma, the stereotypes, the concerns, even questions about my ability to do my job as a nurse. So for her, she actually kind of felt like that transparency kind of turn around and bear in the butt, so to speak. So I think that we have so much more to go to create that kind of comfortable space that you were saying, where we can confront our peers or even have that listening ear, because of the fact that we don't really have a culture within healthcare, and specifically in nursing. I can speak to nursing. We don't really have a culture or environment of compassion for our peers.
And it's very sad. Thank you for sharing that story. For me, I think that's a very sad story, because one thing I've learned with my own recovery, in my recovery journey, is that usually there is untreated mental health issue, which is underlying, okay? A lot of population, I don't have the exact statistics in America, people have mental health issues which are untreated. So for us to be stigmatizing when someone is being open and truthful about what they've experienced, I find that that's not helpful, because a lot of people, unfortunately, are in recovery and they hide it. I mean, that was the whole thing of Alcoholic Anonymous, is that, oh, it's Alcoholics Anonymous, we shouldn't tell people. But this is where, as much as I think it's a great program, this is where I disagree with it, because I've been to AA and I've practiced AA principles, which are amazing. But I think that there needs to be openness about being in recovery. And, I kind of get what she's saying, that when she shares that she's in this program, people start treating her differently. It's almost as if your truth comes to hurt you in this society, whether you share about bullying or leaving your job because you were bullied, or if you have, it's the same thing where they ask you, do you have a disability on a job application, And I can guarantee you 90% of the time people say no, but yet once they get the job, they will say, oh yeah, I have a disability. So we need to remove that stigma that people cannot be honest in what they have experienced. And rather than us being judgmental, maybe have a conversation. For me, it was untreated PTSD. I had PTSD for many years, and I never thought I needed treatment. I thought I was fine. And that's what happens with post-traumatic stress disorder. But after a while, things started happening and they were just deteriorating worse and worse. And for me, it actually started because I was in a program and I was not doing well in this school program. It also happens a lot in college students. I think, mind you, I was a non-traditional student at that time, right? Meaning I wasn't at a traditional age going to school. But if you look at college campuses, workplaces, people are having challenges, People are having challenges working and juggling professional lives. People are having challenges being a nurse, having to not go to the bathroom. What you're telling me, that's inhumane, okay? You're not supposed to do that, because how can you pour and take care of someone else if you're not taking care of yourself? And all these things, going to the bathroom, taking breaks. I think you know this about me. You and I having worked together, like when it comes to things like lunch hour and when I'm going off work, those are, I will tell you that no, it's 5 o'clock, we are no longer talking. I'm off the clock, because those boundaries have helped me with my mental health, and it's part of my coping. So we also need to, but I had to learn that. I didn't know how to do that before. Before, I wanted to be the champion, the one who works, keeps the meeting going or doesn't take lunch. But I realized it wasn't healthy for my mental health, and I think companies need to have things in place in how to protect their workers from these challenges we have, whether it's, people having mental health issues and then self-medicating, just having open conversations, and even having your own people in your company talk about their lived experience, how they managed it, would be so productive rather than this veil of, oh, I'm in recovery, therefore I shouldn't share this with anyone. And I've experienced what your friend has experienced. I remember I went to an interview. It was a great place. It was a place that they dealt with people who were struggling with substance use. And it's as soon as I shared this on my second interview, you should have seen how the room shifted. And I immediately knew that I wasn't going to get the job because I had shared that part. But for me, it was my truth to share. And I felt relieved because why would I want to work for a place that doesn't support me being in recovery?
And so, a question I want to ask you, because something you said there kind of made me think about stigmatizing, like destigmatizing the language, right?
Yes.
Um, because it's crucial to frame that it's not a moral feeling, right? But but it's a treatable medical disease, right? And so in most
Exactly.
cases we're talking about PTSD, we're
Mm-hmm.
talking about depression, right?
Mm-hmm.
We're talking about some maybe fears,
Anxiety.
anxieties, exactly. And
Mm-hmm.
these are often it often takes dedicated professionals who can develop the coping mechanisms and help these individuals deal with this unprecedented stress trauma and help with access to care. So I think for me, I think I think the destigmatizing is probably the part of it that's probably the hardest,
Mm-hmm.
because destigmatizing it means that you're going to now tell this person who is a healthcare professional who's went through years of training, who is on the other side of the table giving feedback and support to family and patients. Now you're going to sit and tell that person that they have been developing poor coping skills, right? And so it almost appears for them in many cases that it's almost like they're living a facade, when really it's not them living a facade. They're just human. And the thing about it is, in our workplaces, we deal with a lot of stress, a lot of anxiety, a lot of trauma inducing events. Looking a patient in the face and letting them know that, when they discharge from the hospital, they may be coming right back because of the fact that they don't have the kind of supports to keep them out of the hospital.
Mm-hmm.
And, or looking at a patient's family and telling them that the patient has a terminal illness, or that the prognosis doesn't look good, or that we had to go in emergent surgery for a particular complication, or a surgery that resulted in a particular complication, and therefore now we have to kind of hold hands with the family and give them updates as they're calling and expressing this frustration. It can wear on you as a healthcare professional to attend to so many different people's needs and patients' needs and family needs, and really no one looking at you as possibly maybe somewhere in your life not having all of the answers, right?
Right.
So I think that that's the part of where we really need to start with the destigmatizing, like not looking at it as a moral problem, because also in this field, there is a morality issue too.
Mm-hmm.
I feel like as a healthcare professional, the one of the characteristics of that healthcare professional that makes the healthcare professional so needed and necessary and appreciated is that moral part of, like, the trust, right? The like you we had a conversation even prior to this chat where you mentioned earlier the idea around integrity. All of those things come to question when you hear about your healthcare professional. Like, let's just think about your favorite healthcare professional, like your primary care provider. If you heard that your PCP was depressed, you probably would think, wait a second, my primary care provider is depressed. Well, they can't take care of me. Well, what about my depression? Well, what about if when they're taking care of me, or am I making them sad? You could just imagine
I can
how
imagine, but
that
I
feels
come
like.
from a different school. If I found
Mhm.
out my primary care provider is depressed, my first question would be, how can I help them beat that? Because
Well,
I
I,
beat
I
depression. Yeah.
and I get that, But I'm just saying, I feel that most people who are not trained like yourself, because you're
Uh-huh.
trained from both your own experience, but you're also a trained professional in this space.
Yes.
So I feel for you, it was kind of more so like a calling, and
Mm,
also you developing the skills to answer those kind of questions, although you are still going through your own process and developing your own strategies. But for most people who don't have that the capacity to do that, they don't have the tools to do that, they don't have the knowledge and the support to do that, they believe it may be better as a kind of don't ask, don't tell. So you hope
mm.
your healthcare provider, your PCP doesn't have that kind of issue, or you're a specialist you're seeing, or anyone helping you. You just hope that they're the happiest, most, put together people in the world here to serve you. And the truth is, what? They're human beings.
They are. We are all human beings. And you know what? Nobody gives us a blue book that this is what life is going to be, and these are the things you're going to go through, and this is how you handle that. No. Unless you start seeing a therapist, which in our Black and brown culture is not something we promote, which needs to be promoted, you know? And we don't talk about these kind of things. We start thinking, oh, there must be something wrong with this person because they are admitting that they have a depression. They're admitting that they have anxiety. They're admitting that they're struggling with substance use. That's not good, you know? It's important for us to bring the talk of therapists, psychiatrists who specialize in trauma, especially in dealing with specifics like healthcare professionals, right? People who have programs for doctors or nurses. Again, going back to the peer support and the incredible power of that is that it really helps if you are in a village like setting. I'm now being an African, because if you know so and so went through something similar and they talk to you, those people I think are more likely to tell you, hey, if you're at that company that you're working and they're not supportive, maybe there's a space at my company. Would you like for me? Because it's also networking. We are always networking, right? Maybe my company is more supportive. Maybe you can come and see what this space is. But in order for you to do no harm, right, as a healthcare provider, you need to first take care of yourself. And you're not taking care of yourself by drinking or denying that you need help when you know you have a problem, right? So it's important to set boundaries, I always say, saying no, protecting your days off, don't work so many hour shift, especially people from immigrants. I know, and I know this for myself. I'm speaking for myself. I was always working. I didn't know when to take time off. I didn't know when to take vacations, or just sometimes just to have days off. It was like I was just always obsessed with chasing the next paycheck, and it's not healthy. It wasn't healthy for me because my mental health was suffering. So we need to be able to talk about things like that in a space where you feel safe, and reconnecting with your family, finding things outside of your scrubs or your professional environment.
This is so important. I think, like you just said, about finding something, a passion or hobby or something outside of work. Again, because the truth about PTSD is, if you're triggered, right, it's not going to help you.
No.
This is it won't, like, the treatment won't help you. Being at work won't help you. Not having a system to resolve some of these sources of anxiety or stress, it's not going to help you. You will be triggered. Something is going to trigger you. Going into certain workplaces will trigger you. Maybe even certain people, smells. You'll have those experiences. Sometimes people with PTSD suffer from flashbacks, right? And
Yes.
so
Yes.
even with that, you can see how, having an alternative or having a place where you can go to and kind of take your mind off of everything, but in a healthy way, like going for walks. I know you're big on long walks.
Oh,
Going for walks is
yes.
very helpful.
Yep, yep.
Yeah, some people like to travel. For some people, like you're saying about peer, like having a strong peer circle, right? Maybe they have experience with substance abuse recovery. Maybe they don't. Maybe they have close family members, or maybe none at all. Maybe it's just that they have the compassion. But it's important for you to tap into that. And so today we've learned that struggling does not make you a bad healthcare professional. It makes you a human one. We've heard of accounts from, again, your own accounts, and my own my experience working with a nurse who was in an impaired nursing program, and it defines the reality of the impairment, but it also shows the importance of compassion and also outlining a pathway. If you take one thing away from this conversation, I want it to be that you are not alone. If you are suffering from any PTSD, anxiety, stress, depression related to work, or it's impacting your work as a healthcare professional, you're not alone. This is a human experience. It's really about making sure that you are protecting your mental health, you are advocating for your own well-being. And it's important to know that if you really want to be impactful in the lives of others, you have to first take care of yourself. And I'm actually going to allow you to give your final words here, and add whatever you would like to add to as we close out this conversation.
Oh, okay. So my final words is just I guess resources. There is a national suicide prevention line, 9888. There's also SAMHSA national helpline, 1-800-662-HELP. There's a physician support line, 1-888-409-0141. And also, most states have their own peer support programs. So look them up, use resources like Talkspace to look for therapists, and find somebody to help you, find someone to talk to, find a peer to support you. So thank you for having me in this space and for allowing me to share about my experience being in recovery, and also just letting other people know that if they need any help, they can also reach out to me. I'm happy to always guide someone find a way out of these dark woods. So thank you.
We want to hear from you. Schedule a free consultation or send us an email at advancednurses@acd4n.com, or visit our websites, www.advancednurses.info or www.acd4n.com.